Okay. So my name is Dr. Alexandra Kopelovich with Physiogram e-learning, and this is clinical gait analysis, temporal variables presentation. We're super excited to present this webinar to you. And as I mentioned, this is going to be a part of series of webinars. And we chose Gait because, well, who doesn't use Gait in their clinical practice, right? It's the most common functional test that people do. And I think it spans from an acute care to neurology to orthopedics. Everybody analyzes Gait. And today what I'm presenting to you is analysis by temporal variables. And it's something very simple, but it's something so great to utilize in your clinical practice. So we'll dive into it as we go on. So a little bit about me. I am a physical therapist, a doctor of physical therapy. I graduated Temporal College in New York in 2014. I started my fellowship then, and I received my orthopedic specialty certification in 2017. And I also started a Doctor of Science program with Andrews University in 2017. So I am finishing up my fellowship this summer, hopefully, fingers crossed, my manual physical therapy fellowship. It was an exciting journey, but I'm hoping it's going to come to an end very soon. And I am teaching kinesiology and biomechanics for Dominican College as an adjunct professor. And that's definitely my passion. And that is one of the reasons why I'm bringing up this clinical gait analysis. I feel like we do teach these things to students in class, but we don't really go through case studies and really teach them how to apply it to a clinical scenario. So that's exactly what I'm going to do for you today. So let's get into it. Just one thing that I wanted to mention, if you guys have any questions, you can type them into the chat, but please do it later after the presentation is complete. This way it's not distracting to other people. And just make sure you keep yourself on mute for the duration of presentation, and then we're gonna jump into the questions after the presentation is over. The duration of this webinar, I am planning for about 20 to 30 minutes, and then I have a little quiz for you guys. No pressure. It's just a Kahoot quiz to see if you actually retain the material. So you can stay for it. You don't have to if you don't want to. That's fine. And like I said, so the reason I chose this topic is that the assessment of symmetry within locomotion and posture is critical in evaluation of neuromusculoskeletal dysfunction. And that is exactly what we're going to be looking at today. So I have no idea how we got these red lines on our PowerPoint, and I have no idea how to get rid of them, but I apologize for these. Yeah, I'm just gonna let this one be, but okay, so the objectives for our presentation today is that, of course, we're gonna review the Gait cycle. Many of you, of course, are familiar already with the Gait cycle, but I always feel like it's good to have a refresher. We will identify the phases of the Gait cycle. We will take a look at the subdivisions, such as stance phase and swing phases of the Gait cycle. Most importantly, we will identify temporal variables that compose the Gait cycle. And when I say temporal variables, I'm sure many of you are very familiar with the terminology, but temporal is in relationship to time. So any variable that can be measured with time. And finally, I think this is the main objective for today's presentation, is to apply the aforementioned variables to your clinical practice. So my goal is for you today to walk out and be able to analyze anybody with a video gait analysis or just watching somebody walk on the street, and just being able to utilize this right now after this presentation. So that's our main goal. Alrighty, so let's take a look at our case study. We're going to be following this case study for the duration of the presentation. This is a 29-year-old female presenting to your clinics with complaints of lower back pain. You ask the patient to walk from the waiting room area to your treatment room, and this is what you observe. So I'm just going to let you for a second just watch this video and just think about what you're seeing. What I want you to think about is, what are some objective measurements that you can record just by watching the patient walk from the waiting room to the treatment area? What are some objective measures? And I need to be able to pull up chats here somehow without changing my window. But um, okay, I want, let me see. You guys can think about it. So think about some objective measurements that you can utilize to measure this patient's gait. And you can type some into the chat. So some of you will probably go to the outcome measures, right? So we're all familiar with functional gait assessment or dynamic gait index. They're great outcome measures, definitely research, but they do consume a little bit of your time, and patient is in a controlled environment, right? Patient knows that you're checking something, so performance is definitely something that's going to influence the outcome of these measures. Another thing that you can do, you can use sophisticated instrumentation, right? So you can use walkways or foot switches, pressure pads in order to measure your patient's temporal variables. But these things are very expensive in the clinic. In order to, I'm not sure of the actual prices because I've never I never worked with these walkways, but I know they're pricey, and my clinic never had them, my clinic in New York. What I offer to you today is a measurement of simple temporal variables. As I mentioned, they're inexpensive, they're readily applicable, and most importantly, they don't consume any of your time. It's very quick. So for temporal variables, what you can do, you can utilize a simple video analysis, as I will present to you today. And for the future, next time I will be presenting on distance variables. And for those variables, you will be able to measure it with a footprint. And I will show you how to do that as well. Okay, so let's begin with some terminology. Okay, so walking is a result of cyclic series of movements, right? Repetitive movements that occur over time. Gait cycle is the most fundamental unit of walking. I think my friend, she sent me how to get rid of these red lines, so I'm just gonna try to do this. Sorry, guys. Annotate. Just give me 1 second. I'm gonna try to get rid of them for you. Okay, never mind. I'm just gonna keep them here for now. Okay, so gait cycle. So let's take a look at this image right here. We have a person walking. We start at 0% and we go to 100%. 0% starts, marks the beginning of the gait cycle, and 100% marks the ending of the gait cycle. So the gait cycle commences, and this is the green line that I drew right here. The gait cycle commences with a heel contact of the right foot in this case, and it ends when the right foot contacts the ground one more time, right? So typically that's the description that you're going to read in kinesiology text. But for purposes of our presentation, in our case, you know that the patient doesn't really contact the ground with the heel. The patient contacted the ground with the forefoot. So of course, actually gait cycle can be measured from any point of the gait. So you can measure it when the patient contacts the ground with the forefoot, but also you can measure the gait cycle from mid-stance of gait. But it has to be from mid-stance to mid-stance or from heel off to heel off. So there are so many different ways to measure a gait cycle, but this is a typical traditional terminology that we learn. So generally, gait cycle is divided into two phases. As many of you know, the stance phase and the swing phase. In the stance phase, some part of the foot is in contact with the ground, while in the swing phase, the foot is off the ground. Stance phase, what's important here, takes up 60%. It's marked with the pink arrow right here. It takes up 60% of the entire gait cycle, while swing phase takes about 40% of the entire gait cycle. And we will be coming back to these values later on. So you will take a look at that. Okay, Oh, the red marks are gone. Yay, thank you. Okay, let's continue with our gait cycle review. So now we can subdivide the stance phase of the gait and the swing phase of the gait. In the stance phase of the gait, we have 5 subdivisions, and in the swing phase of the gait, we have 3 subdivisions. So here, once again, this is the same picture, the same drawing from a minute ago. We begin the gait cycle at 0 to about 60%. This is our stance phase. The stance phase is divided into initial contact, marked with the pink. That's when the heel just contacts the ground. Foot flat, when the entire plantar surface of the foot contacts the ground. Mid stance is when the femur is oriented vertically over the tibia. Heel off, when, of course, when the heel leaves the ground, and toe off is when the toe leaves the ground. Swing phase is also further subdivided into early swing, mid swing, and late swing, but we won't be covering too much of the swing phases of gait for today's presentation. So let's take a look at some objective measurements that we will measure today. So the top ones are for today's presentation, and the bottom ones in green are for the next time. Today, we will be measuring temporal variables, everything that has to do with time. We will be looking at stride time, step time, cadence, stance time, single limb support time, double limb support time. And for the next presentation, we will be examining distance variables. Speed is a combination of temporal and distance variables, but it's a larger parameter, so I chose to present it together with the distance variables, but we will cover a little bit of speed in this presentation as well. You'll see it in a few slides. So this is my universal slide for this presentation, and I think it's a great slide. And what you can do at the end of this presentation, we will be completing this entire chart right here, and you can take a screenshot just for yourself. So this way, you know how to calculate every single variable, and you know, so the first column is the variables, are the variables that we will cover today. The second column is the norm, what's normal in the average population. The third column is the expected, but it's expected for our patient scenario. So you will see what I'm talking about once we get into specific variables. And finally, the last 2 columns are measured for the right lower extremity and measured for the left lower extremity. So like I said, feel free at the end to take a screenshot of this chart, because I think, like I said, my goal for you today is to be able to walk out and to perform the same thing that I'm teaching you right now in 20 minutes. So take a screenshot and do it on your patients, please. I just want to give a little quick credit to the app that I've used for this analysis. This is Huddle Technique. We're not being sponsored by it or anything, but it's a great free app to do slow motion analysis on your patients. And like I said, it's free. So who doesn't like that? And I actually use it for gait analysis, but I also think it's amazing for running analysis. You can also measure angles. And like I said, we're going to be going into a lot of gait webinars here. Some of them we will talk about essential ranges of motion during gait. I think this app is great for that. So this is something I use for this presentation. And like I said, this is something you can download right now in your app store, and it's free. Okay, so let's come back to our case study, circumduction. So of course, many of you already said that it's a circumduction case. That's very obvious, right? So what I want you to do right now, I want you to look at this video and see if you can identify a gait cycle here. So start by just identifying a gait cycle for yourself. Can you actually tell where it begins and where it ends? Now, the second thing that I want you to do is to see how many gait cycles can you identify in this video. So I'm going to give you a second and try to count how many gait cycles in total, full gait cycles. So we're not talking about 1.5, it's entire gait cycles. Can you identify in this video? And I'm just going to give you a second to do so. Okay, so in this gait cycle, we can identify two, in this video, we can identify two complete gait cycles. So let's begin. I think many of us as therapists, we tend to look at the involved extremity first. So that's why my eye kind of automatically falls on the right lower extremity, which should not be the case here because we start from mid stance in the right lower extremity. So it's a little bit difficult, like I said, with a basic terminology to calculate the gait cycle. So we will begin at looking at the gait cycle by following the left lower extremity. So let's see where it begins, and it started right there. And let's see where one gait cycle ends, and it ended right here. So we already have one full gait cycle. Let's see if we have another one here, and two full gait cycles. And you can see the third one. So in this specific video, we observed two full gait cycles. Okay. And in this video, I just pretty much show you how to identify it. This is where it begins. And this is where the gait cycle ends. Okay, we'll watch it one more time. So once again, it's not your traditional terminology where we talk about the heel contact. Right here, obviously the patient contacts the floor with the forefoot. Once again, the beginning of the gait cycle and the end of the gait cycle. Okay, so let's begin with our first variable, which is stride duration. So just to begin, stride is actually synonymous with the gait cycle. So whenever you hear stride, whether it's for walking or running, stride is synonymous with the gait cycle. And you already know the definition of the gait cycle. You know the gait cycle begins with the heel contact of one foot to the heel contact of the same foot. So stride is the amount of time it takes. Let's take a look at this image right here. It takes to go from the heel contact of the right foot to the heel contact of the same right foot. So going from point A to point B, this is our stride length, and the duration, how long does it take the patient to get from point A to point B. Average amount to cover the entire gait cycle is 1 second. It's a little bit over 1 second, but for ease of presentation today, I took 1 second just to round off this value. But typically it's around 1 second. Of course, it will depend on so many different variables, the speed of the ambulation and the stride length and step width and step length, they all really interdependent. But the average studies find that the stride duration is typically approximately 1 second in length. So what we're going to do, we're going to examine our patient who presents with circumduction and see if there is a difference between the norm of the expected of the average and our patient. So let's begin our video. So this is, once again, I utilized huddle technique in order to measure these variables. So we will begin at, just follow this little timer. I didn't want to crop this out. I wanted to make sure you can actually follow what I'm doing to measure this patient's stride duration. So once again, you record the video of the patient during ambulation. Now you do a slow motion analysis of this patient. And now the patient got to, let's get him to 0 seconds. I keep missing 0, but there's a 0, 0. So I started gait cycle from 0 and follow this timer up until the right foot contacts the ground once again. And right here. So we're just going to back up a little bit. So this patient, when the patient contacts the foot, our patient with circumduction, it takes the patient 1.76 seconds in order to complete the entire gait cycle. So once again, we're going to look at these values, and this is something you can compare to the norm. If normally it takes a person on average 1 second to complete the entire gait cycle or stride duration, for our individual here, it takes 1.76 seconds to complete the entire gait cycle, which is almost double the time of the average. So that's definitely something you would want to note as a therapist. So this is a value. I just replaced this as just a different chart. I've just put this together. So it's going to help us out with a little bit of step duration. So once again, gait cycle or stride time, it takes us 1.76 seconds to complete the entire gait cycle. And from 0 to 100, once again, 1.76 seconds. We take this value, we put it into our universal slide. Stride duration norm is 1 second, and measured for both lower extremities is 1.76 seconds. Okay, so we're going to keep this value in mind because we're going to have to do a little bit of calculations once we get into the next few values. Let's take a look at step duration. So now we examined stride duration. Don't confuse stride and step. Stride is, once again, from contact of the right foot to the contact of the same foot, of the same right foot. Step length and step duration has to do with the contact of the right foot to the contact of the left foot. So if you look at this chart, step duration is going from point A to point B, from the heel contact of the right foot to the heel contact of the left foot. What you will see is that typically in your average population, the step length will be equal to half of your stride length. So you can see how one stride will actually have 2 steps. It's going to be the step of the right, the step of the left, and then the step of the right once again. So we have 2 steps that can be calculated within the stride length. Step duration does not always equal to half of stride length, and that's something we're going to see in our case example. So typically, when patient presents with pain, it will affect the affected and the unaffected side for the step duration. So when patient presents with pain, what typically we see in the clinical scenario is that patients will tend to avoid weight bearing on that affected side. That means that the step duration will be lowered, but the patient will tend to spend a little bit more time on the unaffected side. And why that happens is that the patient wants to keep the same stride length and keep the same stride duration. And because they want to progress through their ambulation faster, they will compensate with the unaffected side. And we will see that's exactly the patient case scenario that we will see in our next slide. So let's examine step duration. Let's examine step duration for our patient case scenario. So once again, we're back to the huddle technique. We're gonna start counting off the step from the right foot to the left, and you're gonna see the timer go to 0. Give it 1 second, and negative, negative, 0. So this is where we're gonna start counting our step duration. And from here, follow the timer up until the left foot contacts the floor. Okay, so we're gonna just back up a little bit, and that's going to be about 0.60 seconds. I have 0.53, so 0.60 to 0.53 seconds. That takes our patient to perform a step. Once again, so normal step, what you would expect is, how do we derive a normal value? The entire gait cycle is 1 second. Step is going to be half of that 1 second, which is going to be 0.5 seconds. So this is the norm that we derived right here. So this is the 0.5 seconds that we have right here. Expected value. What are our expected values? Our expected values are the values that we expect of our patient to perform. So for how did I calculate 0.88 seconds? For our patient, we're going to go back to the slide right here. It takes 1.76 seconds to complete the entire gait cycle. So 1 step for our patient should be half of this 1.76 seconds. So this is where the value of 0.88 seconds comes into play. So once again, norm is going to be 0.5 seconds because the entire gait cycle is 1 second. Expected is 0.88 seconds because our gait cycle for our patient is 1.76 seconds. And what we found, what the observed value is 0.60. right? So our observed value is definitely below the expected value. And once again, this is exactly what I mentioned a second ago, was when a patient presents with pain, the step duration will decrease on the affected side. And that's exactly what we see here. If we compare the observed value with the expected value, it's way smaller, it's way shorter. Let's take a look at step duration on the left lower extremity. So another thing that you can do, you can of course compare these values to norms, to the average population, but you can also compare the right lower extremity to the left lower extremity. So let's take a look at the step duration at the left lower extremity. So we begin at 0. So this is where the left is bearing, and now swinging of the right, and now the right contacts the ground again, and we're at 1.16 seconds. So once again, we're going to cover these values. The norm comes from the fact that the entire gait cycle is 1 second. Step takes up half of the gait cycle. So that's going to be 0.5 seconds. The expected value is derived from our patient's entire gait cycle. It takes our patient 1.76 seconds to cover the entire gait cycle. What is expected for step duration is half of that value, so that's 0.88 seconds. The observed value is 1.16 seconds. So once again, our patient takes longer than expected, even for our stride, not even, it's way over average, right? You can see 1.16 is way over average, but even over expected, if the patient was just walking slowly, that's not the fact. There is definitely a discrepancy between the right and the left step duration. So I made this chart for you. And once again, just to compare to have, I'm a visual person, and I'm sure a lot of USPTs are visual and, well, tactile mostly, but definitely a lot of you are visual people. So let's take a look at this chart right here. So this is a summary of what I've covered in the last few slides. We have our patient contacts the ground, and it takes our patient 0.6 seconds to take the left step. But it takes our patient 1.16 seconds to take the right step. So weight bearing on the right lower extremity is way shorter than weight bearing on the left lower extremity. So the entire gait cycle spans for 1.76 seconds. Weight bearing on the right lower extremity for 0.6 seconds, and weight bearing on the left lower extremity for way longer. So once again, we're coming back to this equation, which I mentioned in the beginning, and it perfectly fits the book. Together with the pain, patient will present with decreased step duration on the affected side, and it's decreased in our case. And together with pain, patient will present with increased step duration on the unaffected side. And that's exactly what's happening. So once again, these strategies, this increased step of 1.16 seconds is a reason why patient wants to have a longer stride length. Patient wants to be there in a shorter period of time. So that's why these things actually happen. These are compensatory strategies, compensatory patterns. Now we're going to take these values and place them into our universal slide. So once again, step duration, 0.5 seconds is the norm. 0.53, 0.60 is measured for the right lower extremity, and 1.16 measured for the left lower extremity. So these are the values that we're measuring, okay? So if you can compare your measured outcome to the norm, or you can compare the right to the left. And you can tell there is a huge discrepancy between all of these values. So there is definitely, it's a great way to carry on measuring your patient's progress throughout therapy. Okay, let's take a look at our next value, which is cadence. It's also known as the step rate. Cadence is the number of steps taken per unit of time. Normative values typically for cadence would be 110 to 120 steps per minute. Some literature reports for it to be 90 to 120 steps per minute. Really depends on the individual, of course. Women tend to walk with shorter but faster steps. So it also varies in between genders as well. So what we see here is that cadence actually has a relationship with speed and step length. And I find it very interesting because that's something you can measure for your runners, but also people in the clinic just ambulating. So like I said, speed and step length are not two variables that we will be really discussing in this conversation. We will be discussing it during the next webinar in 2 weeks. But in this presentation, we're looking, I just wanted to give you this equation so this way you're a little bit familiar with that. So speed is how many meters can you cover per certain, in a certain period of time. So meters per second or meters per minute. So that's your speed. Step length is the length of your steps. So that's something we already looked at. How long, how far does it get to go from the right, from the contact of the right lower extremity to the contact of the left lower extremity. That's something we discovered. So what's interesting here is how do people increase speed? There are two different ways to increase speed. You can increase speed by increasing your step length, right? So if you step a little bit further, you're going to be able to increase your speed. You take longer steps. Another way to increase speed is to be able to increase cadence. So take more frequent steps. Or you can utilize both of these components. You can increase your step length and you can increase the frequency of your steps. And this way you increase the steps, and that's how people start running, right? So Lamoureux et al. With his colleagues, they found that when a person walks between a cadence of 80 to 120 steps per minute, there is a linear relationship between step length and cadence, meaning normally individuals, we tend to increase our step length as well as increase the frequency of our steps. But once we pass the mark of 180 steps per minute, what we start doing is, of course, we can take very super long steps because we're going to start tripping and falling, and that's also energy inefficiency. So our step length becomes plateaued. So we're going to maintain the same step length, but we will start increasing in cadence. So cadence is, like I said, it's such an interesting component, and I definitely look at it a lot with my runners as well. What's second equation here is increase in cadence will decrease in double support period relationship. And we'll talk about double support, but pretty much double support is when you have 2 feet on the floor. So the faster your feet go, the faster the frequency of your feet moving, the less double support phase there is. And as a matter of fact, once we start going past 180 steps per minute, that's when walking stops and running commences. And that's when we completely lose the double support period. So that's an interesting fact. And one more thing I just wanted to mention, it's out of the scope of this presentation, but just for people treating runners here. One thing that research noticed is that there are a lot of lower extremity injuries related to cadence. So what they find is that the runners, they present with slow cadence and excessive stride length. So they're striding very far, but they're not, the frequency of steps is very low. And that is related to shin splints, to tibial stress syndrome, to patellar dysfunctions, to so many lower extremity stress and tendinopathies and fractures. So what a lot of people, a lot of trainers who train runners and a lot of physios also tend to do is that just by twitching the cadence of the runner, you can make a huge difference. So training the runner to take shorter steps, but making them frequently will definitely reduce their risk of re-injury or injury in the first place. So that's just a tip for you guys. The next slide, this is just something I've put together. Like I said, there is a linear relationship between speed, cadence, and step length. When the speed increases, one more time, when the speed increases and goes past 180, 190 steps per minute, we can see that the cadence keeps increasing while the step length keeps plateauing throughout. So that's just interesting thing to note for yourself. So let's take a look at our patient case scenario. Let's come back to that cadence measurement. So like we said, the norm for our patient would be 110 to 120 steps per minute. So in order to calculate cadence, I just put together this calculation here. All you do, you measure the steps taken per unit of time, right? So this is how you're going to measure it here. So here I'm going to calculate the number of steps my patient takes per unit of time. So follow this timer as it's going to start from 0 and go to whichever point, 9.30 seconds. And this is where we're getting our equation for cadence. So let's calculate the number of steps for a patient. Let's play this video, and it's going to be, and 1 step. I'm going to calculate strides, 2 stride, and 3 stride, and 4 stride, and 5 strides. So we can see 5 full strides here, which commences in 9.30 seconds. So in order to calculate cadence, you're going to calculate the steps that the person took, and I've counted the strides for you. So the steps will be double the stride, right? Because we said stride is the entire gait cycle, and we have 2 steps in 1 gait cycle. So we are going to have 10 steps over 9.30 seconds. And what we observe for our patient is that the cadence is 64 steps per minute. And that's a good value to note. So let's go back to our chart. Okay. So once again, we're at our universal chart, and here we can see cadence, the norm, what we're expecting for general population, which is 120 steps per minute. And what we measured for our patient is 64 steps per minute. This is, 64 steps per minute, not 32. This was, here you go, 64 steps per minute. So it's half of what we actually expect for a normal patient case population. And once again, these values are so easy to measure. You go back, you take a video of your patient, and all you have to do is calculate the number of steps taken per unit of time. There is no need for complicated measurements. Okay, let's go up to our next value, which is the stance time. This is our next variable. And stance time is something many of you are already familiar with. Stance time is the amount of time elapses during stance of 1 low extremity. So it begins at 0% of our gait cycle, and it ends at 60% of our gait cycle. So stance time is 60% of the total gait cycle, right? That's what we said initially. There is a stance phase of the gait, and there is a swing phase of the gait. Gait takes 1 second to complete. If stance phase is 60% of 1 second, therefore it means it takes 0.6 seconds to stand on 1 low extremity in this case, to weight bear on the right low extremity in this specifically. So once again, so the average stance time is 0.6 seconds, right? So we calculate from 1 second, which takes for the entire gait cycle, and 0.6 seconds is 60% of the entire gait cycle. Let's calculate the expected stance time for our patient case scenario, right? So we have the expected stance time calculation. Once again, we're going to calculate 60% of our gait cycle value. So here we're going to take 60% of 1.76, and our expected stance time would be 1 second, about 1 second, 60% of the stance time. So let's take a look at our actual measurements at the observed stance time. So once again, follow the timer, and the stance time begins when the patient contacts the floor with the right foot, and it ends when the right foot leaves the ground, right? As you can see here. So now we're at 0, the right foot is in contact with the ground, and now the right foot leaves the ground. So this is where at about 0.99 seconds, this is our observed stance time. So our patient tends to spend 0.9 seconds in stance on the right lower extremity. Let's take a look at the left lower extremity. The expected stance time is, once again, for our patient case, is 1 second. The observed stance for our patient is, follow the timer with me here. We're gonna start weight bearing on the left foot, and the left foot lifts off the ground, and that's at about 1.36 seconds. Okay, so let's take a look at a difference between the right and the left foot. So the left lower extremity took 77% of the stance phase, while the right lower extremity took 51% of the stance phase. So our what we would expect is 60% of the total gait cycle. In our case, on the right, on the involved lower extremity, patient was weight bearing for 51% of the gait cycle, which is 10% less than what we would expect. And weight bearing 10% more, 17% more than what we would expect on the left lower extremity. So once again, there are discrepancies between the right and left lower extremities. Once again, back to our chart. So here, from 0 to 100 is the entire gait cycle. From 0 to 50, this is our stance time. So our patient doesn't go up until 60% of the gait cycle. Our patient only goes to 50% of the gait cycle. Let's continue. We're continuing to fill out our universal slides. Stance duration norm is 0.6 seconds, derived from 1 second of the entire gait cycle. Measured is 0.9 seconds for the right lower extremity and 1.36 seconds for the left lower extremity. Okay, we have 2 more values to cover. Almost there, guys. Let's go. So single and double support time. So take a look at this chart right here. So once again, we're beginning our gait cycle. We go from 0 to 100. When the patient contacts the ground with the right foot, there is a 10% transfer from the left foot to the right foot. And that is called a double support time. There are 2 periods of double support time in gait. It occurs at the heel contact of the right foot, and the second one occurs at the heel contact of the left foot. So 2 periods of double support time. There are also 2 periods of single support time. Single support time meaning that the patient stands only on 1 foot entirely, only on 1 foot. So that commences from 10% of the gait cycle for the right lower extremity and ends at 50% of the gait cycle for the left lower extremity. Now, for the left lower extremity, it starts at 60% and ends at 100% of the gait cycle. So 2 periods of double support time and 2 periods of single support time in 1 gait cycle. The double support time only takes 10 seconds in both cases, 10 seconds here and 10 seconds here. Single support time takes 40 seconds, 0.4 seconds, 0.4 seconds here and 0.4 seconds here. So it's way longer, the single support time versus double support time. Let's take a look at the single support time. Single support time, as we mentioned, is the amount of time that elapses when only 1 foot is in contact with the ground. So when you're only weight bearing on 1 foot. So that starts from 10% of the gait cycle and ends at 50% of the gait cycle for the right lower extremity. And that's exactly what we will be looking at. Let's take a look at our patient case scenario. Once again, see how we can actually measure it. So we will measure the single support time for the right lower extremity by observing the patient only weight bearing on the right foot. So we know that when the patient contacts the ground with the right foot, we know that the patient will begin in a double support phase. But we're going to wait when the left foot actually lifts off the ground, and that's gonna that's when we're going to start the calculation for the single support time for the right lower extremity. So let's take a look at that. Let's follow our timer. I'm going to start it from 0. So here's the beginning of our right single support time up until the time when the left foot contacts the ground. And this is the point where the left foot contacts the ground. So in our case is 0.33 seconds, weight bearing on the affected side, okay? So let's compare it to the norm. Norm is 0.4 seconds, as I mentioned. It takes 40% of the entire gait cycle to bear weight on the right lower extremity. And in our case, we're weight bearing for only 0.33 seconds, okay, which is less. Let's examine and compare it to the left lower extremity. Once again, the norm is the same, 0.4 seconds for both lower extremities. Let's begin calculation. So we begin once the right foot leaves the ground. So that's our 0 point. And we're gonna stop the timer once the right foot slightly touches the ground, and it's going to be 0.76 seconds. So our norm for single support time is 0.4 seconds for both right and left lower extremities. What we observe in our patient case scenario is that patient is weight bearing on the left lower extremity for 0.76 seconds, which is almost double the time of the expected and double the time of the right lower extremity. Okay, so of course, let's continue and look at our values. So this is our universal flow sheet. So for our norm for single support time, we expect it to be 0.4 seconds. Our measured single support time for our patient is 0.33 seconds. And our measured for the left lower extremity is double that amount, is 0.76 seconds. Let's continue. We're going to go into our last value, double limb support time, and we'll just reanalyze everything quickly. So once again, double support time, 2 periods throughout the entire gait cycle, and they're only 10% of the gait cycle, which means you really think, when I think about walking versus running, I think, yeah, we spend so long really in between 2 feet. But it's really not that long. It's 0.1 second on the right foot and 0.1 second on the left foot. We really spend a lot more time in a single support phase rather than double support phase. And that's something as a therapist you should definitely be aware of when training your patients for ambulation, when trying to create that energy efficiency and stability for them for gait. So like I said, double support time, right lower extremity, 10 seconds, and left lower extremity, also 10 seconds. Let's take a look at our case, okay? So double support time is gonna be very short on this video because of course you have to be able to catch it. So we'll get the timer to 0. So we're weight bearing on the left and switching the weight to the right up until the left foot leaves the ground. And that's about 0.30 seconds. Okay, in weight bearing on the right lower extremity and the left lower extremity. And for the opposite, for the continuation of the gait cycle, double support time for the left lower extremity is once again 0.33 seconds for both of them. So let's take a look at our values. We have our entire gait cycle, which took us 1.76 seconds to complete for our case study. Right lower extremity stance is 0.90 seconds, which is only 51% of the gait cycle. We expected it to be 60, but it's 50% of the gait cycle compared to the norms. Single support time is 0.33 seconds. We expect it to be 0.4 seconds, so definitely less than what we expect from the norm. And double support time is over the norm, right? We expect double support time to be 0.1 second, and in this case is 0.3 seconds. So it's definitely over the norm. So these are great values that you can keep for yourself as a progression of patient gait training, but also present to insurance companies as well. So let's take a look at our case study values and our universal flow sheet. And I'm just going to leave it here for a second. So if you need to, you can take a screenshot of these values so you can actually have the norms. And these are just measured for our patient case scenario. So that's obviously going to be different from patient to patient. And I'm just going to leave it here for a second for you to take a screenshot. Okay. If you need any part of this presentation, I'm very happy to share. You can reach out to Physiogram World, or you can reach out to me personally on Instagram. So whichever one is better for you. So here are our references. And we would like to announce that, like I mentioned in the beginning, this is just the beginning of our journey here. We will be covering way more Gait topics. I am very excited for it, and I hope you are as well. So our next webinar will take place on May 1st at 11 a.m. and it is free. It's a free webinar. The topic that I will be covering is clinical gait analysis distance variables. And I think it's a fun topic to cover. And I already prepared my presentation, so I really hope you will enjoy it as well. So join us May 1st at 11 a.m. Eastern time. To register, of course, go to Instagram, go to Physiogram World and register in bio. And one more thing, and if you want to stick around, we can do a little bit of gait analysis. This is a different patient case, so it's a little bit trickier. So whoever wants to stick around, feel free. Go to Kahoot.it, and we will do a little quiz. You don't have to put your name down or anything. It's just for fun. So let's just see how much of this information you actually retain. So let's try it. Go to Kahoot.it. And I'm gonna stop sharing. And I will give you a pin. I will actually just share my screen. I will share my entire desktop. Okay, so this is the pin. Once you get to Kahoot, you can just enter the spin and we're going to play the game. I'll give it another 30 seconds and we'll start. Okay, so I would want you guys to watch this video as well as we do Kahoot. Okay, so let's begin. So what I want you to do is that you can all see my entire screen, my desktop. So you can see Kahoot and you can see a little bit of this video maybe I can just, yeah, I can make it. No, you have to see the timer. So I am going to start. Okay, I'm gonna decrease the volume of the Kahoot. I'm going to start the video and I am going to start the Kahoot. You're gonna have a few seconds to watch this video and identify the variables that we discussed in today's presentation, okay? I hope still more people are joining, which is great, but we're going to start. So I think more people are joining, okay? So I'll let you watch the video just for yourself. So mark the timer. Most of these you won't have to do any calculations on. And I tried to do it in slow motion so you can actually see way more. So this is your patient. And I will ask you for different values in this patient, such as step duration, stride duration, and just mark off the best value, the best multiple choice value. Okay, are you ready? We're going to start. I'm just gonna make this Kahoot window. Yeah, perfect. So this way you can see the Kahoot and you can also see the video. I hope yeah. Yeah, that's better. So you can see a little bit more of it. Yeah. Okay. I hope it works because I have so many screens here. Oh. Okay, more people are still joining, sorry. Let me just do this. Yeah, okay, that's perfect. Okay, I'm gonna keep this video on play so you can actually watch the video, watch the time, and we're gonna start the Kahoot. Okay, Gait, temporal variables in Gait. So you can also see the Kahoot in your screens. What is the duration of this Gait cycle? Pick the best. I'm gonna restart the video. Pick the best value. What is the duration of this Gait cycle? Okay, let's see. So we're kind of all over the place here, but that's okay because the video is going pretty fast, I would say. In a normal case scenario, you can actually pause the video and actually see your value. Here you cannot. So our Gait cycle takes us, so let's see. So the patient stands, here we start with 0, right? So that's why I'm giving you these numbers. We start with 0. Was contact of the right foot, and we're waiting for the right foot to contact the ground once again. So left foot is in contact and the right foot. Okay, so the closest answer would be 1.56 seconds, 146 in this case. Okay, so that is the correct answer. Okay, let's go to our next one. Congratulations, M. Okay, quiz number 2, we're gonna keep on playing. What is the stride duration in this case? The video is playing. Wait for it. So there was the 0 mark. Takes a while to finish watching the video before the time is up on Kahoot. Okay, so the stride duration, 8 people got it great. 8 people got it right. Stride duration is synonymous with a Gait cycle. So in this case, stride duration would be the same number you chose for the first one. So it's 1.46 seconds. Great job, guys. And H this is on top. Good job. Now, what is the step duration? Okay, I'm gonna start. Start from the beginning. Watch the video. Come on. Oh, no, I didn't start, sorry. Okay, there we go. It's going. I hope you get to see it before the timer ends. Okay. It was 1.86 seconds. Yeah, everybody got it. So You could have obviously watched it, but you could have obviously also guesstimated it because step is half of the stride. So you can actually look at the numbers and see which one would be half of the stride. But in this case, of course, not always step duration is half of the stride. That is something we covered in this webinar, and I hope you understand the difference now. And who do we have on top? H Diz is on top. Great. What is the stance time? Okay, play again from the beginning. I tried to be fast. Explain. What is the stance time on the right low extremity? Sorry, to specify, right low extremity. Okay. I'll replay it. Oh, too late. Kahoot is faster than we are. Okay, so yes, 7 people got it. The majority got it right. The stance time on this low extremity is 1 second. And that's exactly what you see. We're gonna start with the contact point of 0. And stance time will end once the right low extremity leaves the ground. So watch it, and it was at about 1.9 seconds. That's what I saw. So 1.6 seconds is the closest value to it. Okay, we have, I think, 2 more to go. Almost there. Super dog. Okay, good job. Okay, what is the single support time here? Gotta play the video. Okay, single support time for the right low extremity. Okay. All right. And the majority got it right. It's 0.6 seconds. So once again, how do we calculate single support time? So we are going to begin from, it's a little bit trickier because here you have to do math. I start at the contact of the right foot, but here we begin with a double support time. So that's a tricky part right here. So here we need to mark this point right here when the left foot leaves the ground, right? So it's 0.26 seconds. And mark when the left foot hits the ground again. It's 0.89 seconds. So 0.80 minus 0.20, it's going to be 0.60. And that's exactly the value that we're getting right here. Okay, last one. And Super Dog is still on top. What is the double support time for this patient? And let's play it and explain. Okay. Oh, yay. Most of the people are getting it right. It's 0.23 seconds. Absolutely correct. So you can measure it at any point of the gait cycle. So here, you can already measure it here because you can see that's where the gait cycle begins. And this is where we lift the foot. So that's exactly at 0.23 seconds. Alrighty, I just wanted to thank all of you for joining us today. And if you have any questions, I'm gonna stick around. And I see there's some a lot of comments. I haven't seen them before throughout the whole presentation, so I will look at them right now. But if you have any questions, please, you can raise your hand or just unmute yourself because right now we're in unofficial time. So I'm going to stick around for another 5 to 10 minutes to answer any questions that you have. But thank you so much for joining us, and see you on May 1st, 11 a.m. for another gait analysis. Bye, everyone. I see some people are coming up with questions. Okay, there is a question from Lexi. How do you know which stride during the video to pick? Do you have the patient walk for like 10 meters and film the middle of it? Just so it's most representative. Oh, yeah, absolutely. So definitely have the patient walk a little bit, but even you want to observe patient in their most natural environment. So whenever you ask the patient, even walking from the waiting room to the treatment room, that's the best time to really eyeball it at first. And then, of course, later, once you're going to record it, you want to get that middle piece when the patient is kind of off guard. They're not really concentrated on, okay, right now I'm going to walk. So that once again gets rid of that performance aspect element of it. Yeah, so at any point, and once again, you can also do average. You can just record them over a span of 1 minute if you have that luxury in your clinic, and you can take the average of those strides. So it's really up to you. Oh, I think somebody's asking about the recordings. Yes, so you will receive a link to this video in your email. So absolutely, if you need to rewatch it, we might even do another live webinar on the same topic. So if you feel like joining another live webinar that will cover this, like I said, temporal variables, and maybe I'll go into some different comparison or maybe a different patient case scenario, depends on your request. Yes, definitely we can do it. But in terms of the recording for this specific webinar, yes, there is one, and we can email it to all of you. Anybody else has any questions? It seems pretty quiet, so I guess we're going to be wrapping up the webinar. I'll give it another 2 minutes if you want to come up with any questions. And otherwise, I'll be seeing you at the next webinar. All right, we have another question from Carol. Thank you so much. You're welcome. When do you use this tool, gait analysis? Me, for example, work in primary care and my time is restricted. So this is exactly why I did this presentation. In primary care, they do want you, probably to do a lot of specific gait parameters, but this is just a simplistic way to analyze somebody's walking and to actually measure their progress. And obviously it took me, well, today about 40 minutes to explain all of these variables to you. But in real life, and once you're actually going to record the patient, you don't have to do all these variables. If you just measure cadence and you measure single limb support time, that's already two great values to have to document progress of the patient or to plan their treatment based on those values. So I think, honestly, it takes for me to record these videos and to do the analysis myself. It took me maybe 30 seconds per piece. So to do all these variables, it took me 2 minutes worth of time. So I think it's a great alternative to outcome measures. And like I said, probably in the primary care, you're probably doing a lot of specific outcome measures. But this is just a quick, easy, simple, and not at all time consuming procedure. So I hope you actually find it useful. Alrighty, everyone. I will be ending the Zoom meeting. It was great seeing all of you, and I hope to see you at the next webinar, May 1st, 11 a.m., and we'll cover more gait parameters. Have a great day and see you May 1st.